Medical Director for the State Office of Public Health for our region.
She's going to thump you in the head.
Hey, Dr. Martha, you must have had you and every other physician probably around the world, now that I'm thinking about it. Tell us about your weekend. Before we get to the latest coronavirus, just tell us how busy you were this. How many hours sleep have you had in the last 5 days?
Not many.
Oh, my God.
Not many at all. I'll tell you, I feel like everybody who has my cell phone number has shared that cell phone number with at least 2 people, because I have everybody calling me, which is, I don't mind. I don't mind helping people if they have questions or if they're nervous. But it has been overwhelming when you add that to all the regular calls I'm getting, trying to take care of the situation that we have going on.
So bring us.
It's been a little busy.
Bring us up to date. Where are we about the number of patients in Caddo and Bossier and the situation, et cetera?
So we have 3 cases, and I know that's a little confusing because the governor has announced 2. We have another one that has come out since he announced, and he'll announce that one this morning. So when you hear a new one, it's only 3 total.
3 in Caddo, 1 in Bossier, right?
1 in Bossier.
Okay.
Are you surprised at this point that it's not more, or given the relative lack of testing? What are your thoughts on all of that?
So we have a lot of cases pending in our state lab. And we have had one of our positives was a local physician testing through a reference lab. So we are seeing results coming from both directions. I do not get the number of negatives, so I can't really judge how many people are testing. Up here, we right now, while nobody has a lot of supplies, like the biggest issue is the transport media that you break the swab off and stick it in to send to be tested. But right now, everybody has some, they just don't have a lot. So if we need testing, there is availability. In New Orleans, there's more issues than we have. They're running low, so that's what, the Fed said that they were going to help with all that. So we'll see how that pans out this early this week.
You're talking to a lot of people this morning, Dr. Whyte, who stayed kind of home this weekend, kind of didn't get out much. Should we continue that? Is that something we should do? Or is it okay to get out?
So right now we don't have the cases to say that we have a community acquired, a lot cases or a lot of virus in our community. That may change in the near future. What I would say is, if you're young and healthy, we're not saying don't see anybody, don't ever go out to dinner, don't go to a movie. Just use your common sense. And if you're around someone sneezing, maybe we need to take a step away. And if you're elderly or if you have a lot of health issues, those are more the people we want them to think about. Could I send someone to a really crowded place for me? Could I send someone to the grocery store? Can they do some of the errands that maybe I usually do myself, just to kind of protect them from being in big crowds?
Dr. Whyte, let's walk through.
We're not asking people to completely change their life.
Let's sort of touch on this a little bit, because the people I talked to this weekend, if there's one bit of information that most people don't have or don't understand, and you correct me if I'm wrong, and I don't think so, is that the biggest danger here is not the severity, but we're talking numbers, and specifically the fact that this has about a 2-week incubation period, where the regular flu, the seasonal flu, is about 48 hours, right?
Well, the flu has a little bit longer incubation, but yes, once you're exposed to it, you may not show symptoms for 2 weeks. So that's why, you heard people having to stay home if they had been exposed. What my biggest thing that people don't understand is, what is a contact to someone? So say you've heard the name of the person who has the virus. just because you rode in an elevator with them, or maybe you gave them a hug, or you passed by them at work down the hallway, that's not a contact. To be a contact where you're really at risk for getting the virus from somebody, you have to be within 6 feet, you close contact, face to face, for an extended period of time. And that extended period of time is 20, 30 minutes. So we're not talking about like a short conversation like, oh, hey, John, do you have this this memo I need from you? And he hands it to you. That's not a close
I'm
contact.
so glad you mentioned that, because I'm in contact with the first Caddo patient, and his family's still testing negative. They're self-quarantined together, but nobody else in his family has tested positive. So something else has to happen, right?
So while it is contagious and it's very infectious, we've seen it. Some people are saying higher than the flu. Most people are saying about as infectious as the flu. What we're seeing is you really have to be close to them. So, like, you'll see a spouse who's sleeping with their husband in bed at the same time, people who are, in a meeting across the table from each other for an hour or so. Those are the people that we want to make sure we talk to and that we have watched themselves for symptoms and keep themselves at home for a while.
Dr. Whyte,
just being in a building is not a contact.
I spoke to a couple of doctors this weekend, and they both made an interesting point that all, or at least most, you can clear that up, of coronaviruses at this point are seasonal, i.e. they tend to disappear when the weather gets warm. What do you think about that for this one?
So they're not seeing signs that that's going to be the way this virus acts. We are learning every day about this virus. Will it be that? I'm not sure, but from what I've read and from speaking to some local experts, they're not thinking this is going to be seasonal this year. It may change in the upcoming years. It is very much like the colds and flu season. That's what we normally see coronaviruses as. Will this adapt to that? We hope so.
What symptoms should people be worried about this morning? Somebody waking up with a scratchy throat or a cough? What are some telltale signs?
So most of us know what our allergies are like. If you're not having a fever, if you're just having, you slept and you woke up with a scratchy throat, it goes away as you get up and get moving around. Have a little sneezing and cough, because you always have that with your allergies. Don't worry. What we're seeing with this virus is most people are having muscle aches, feeling weak, headaches, and sometimes the cough starts at the same time. Sometimes it comes a few days later, but they almost always have fever, and it's not just a low-grade fever. It's like 101, 102. So most viruses will hit you in multiple spots at one time. So it's not like you just have a sore throat. It tends to make you feel bad.
Dr. Whyte, I'm going for a little good news here to wrap up. You had made the point, and a lot you see it all the time. There's all these people out here. There's all these people all over everywhere that have it and don't realize it. By the same token, isn't it possible and or probable rather that there's a lot of people that had it, didn't know they had it, and have gotten better?
Right, there is that possibility, and we're thinking and hoping that as this comes back around in the next years, we won't have to worry as much because we'll have a lot of people who have those antibodies. What we're worried about with this virus is just that nobody's been exposed to it before. So we were trying to limit how many people really got sick this year, so that next year it would be even less, and the next year even less. Does that make sense? Mm-hmm. So let's not worry. We're just trying to contain it and mitigate it, is what we're calling it, so that we don't overwhelm the health system and that we don't see a lot of people who are in fragile health conditions. But remember, 85% of us are going to be just a mild cold.
Asking for a friend real quickly. Next week was scheduled to be spring break. A lot of people have travel plans. If you're driving to the beach and you can stay in your own condo, you okay? You're okay with that kind of a deal?
I'm okay with that kind of deal as long as you're looking at, you're not necessarily going to Seattle.
Right.
You know, places where we have a large number of cases. New Orleans right now is not the best place to go for a holiday. Hate to do that to New Orleans tourism, but they're having a lot of cases. So just be smart about where you're traveling to and what kind of situation you'll be putting yourself in. But if you can do like you're saying, have some space, yeah, go enjoy yourself. Nobody's asking you to lock yourself in your house.
Gotcha.
Just limit the number of people you're in contact with at one time.
Dr. Martha Whyte, thank you so much. Please thank your staff. I know y'all been working around the clock. We appreciate your time.
Anytime, and thank y'all
Don't
for
don't tell her
helping us stay
anytime.
calm.
Pardon me, Doc. Don't tell her anytime. You know that as well as I do. Thank you, man. We'll talk to you soon, I hope.
Take care, Doc.